This is a podcast about the power of lived experiences, about how stories can shape more human-centered systems, spaces, and services.
Each episode, we sit down with people who are challenging the status quo, leading with empathy, and helping others through their work and their stories.
We're Farah and Megan, and this is Collected by Unum Co.
Welcome back to Collected by Unum Co. I'm Megan.
I'm Farah.
And today we are so excited to be sitting down with Maria Haugen, the founder of FoXX Health. Maria's personal experience with a health scare and the dismissal she faced along the way sparked a mission to help other women advocate for themselves in the healthcare system. Through FoXX, she's building an app and a movement that gives women the tools, confidence, and support they need to be heard. Maria's story is exactly the kind of story we want to amplify here at Collected. A person, a patient who saw a gap and is now working to fill it, not just for herself, but for so many others. We hope you come away from this conversation as inspired as we are.
So with that, welcome, Maria. We are so glad to have you. And we really want to jump right into things. So we're hoping that you can start by sharing a little about yourself and about the health episode that you went through.
Absolutely. Well, hi to both of you and to everyone listening, viewing. I am very excited to be here and more importantly, excited to share my story because I hope women know that they're not alone when you feel scared and dismissed, and FoXX is on the way. A little about myself. I have started my career as a founder, in the past year, but before that I was business oriented. I was working in consulting. I have my MBA. I was doing what is supposed to be the right path and not finding much meaning. But while this was happening, I was also going through my own health episode where I felt like I was having heart attacks. And when I was Googling my symptoms, it would say you're having a heart attack, go to the hospital. After doing an EKG, I was not having a heart attack. And in speaking to my primary care provider, it became very clear that I was being labeled as overly emotional and anxiety ridden, which history had shown I was not. And for some reason, that was the diagnosis now. It was a lot of come back in 6 months if it's still happening, and I'm going to prescribe you anti-anxiety medications and stop exercising, when in fact, none of these had been an issue before this started happening. All the while, I felt as though I was having a heart attack and these episodes were happening on a regular basis. And by regular, I mean probably once every week to 2 weeks. And that was terrifying. I was faced with my own, life questions. When would the heart attack actually come? Why would no one listen? And I started cold calling cardiologists because my PCP would not give me a referral. And I started telling them what was going on and please help me. And I was met with, understandably so, a lot of sorry, without a referral, no. However, one cardiologist did say, okay, the doctor agreed to get you in because, of course, I was talking to reception. But because you're non-emergent, it's going to be a wait, about a month and a half. So by the time I did go to the cardiologist, it was around 6 months of feeling this way, of not exercising. And truth be told, I was also not taking the anti-anxiety medication prescribed for me because I knew that was not the issue. The only thing giving me anxiety was these episodes. And so by the time I went into the cardiologist, that first appointment, it was, oh, yeah, you have costochondritis, which is a heart condition with symptoms that can mimic heart attack symptoms, especially in female patients. And I was prescribed medication, and I took that for around 4 to 6 months, and I've been fine ever since. That was a relief. I am very healthy. I am doing well. My heart is okay. And looking back, very clear-minded, the situation was not okay.
Mm-hmm.
And there had to be a better way. And that's really where FoXX came into play. About 2.5 years ago, I started thinking about how, with all of my experience and knowledge, could I actually make an impact? And it wasn't just complaining about what I went through. It was, let's get down to it. What was I missing? And then I need to go talk to people. And by people, I don't just mean women who have similar experiences. I also mean the doctors. My experience, although a lot of women can relate, is not at fault of the doctor. they're trained to, when you hear hoof prints, think horses, not zebras, right?
Mm.
And they can't, give everyone, well, it might be the most, non-descriptive type of whatever disease. They're supposed to be smart and they're supposed to be nimble and they're supposed to help us with what they think is best. That being said, there had to be a way for us to better present ourselves to the doctor. Women have a higher misdiagnosis rate and a longer time to misdiagnosis, and that's what we're addressing. So, in speaking to doctors and patients, I realized that women are more likely to misrepresent their symptoms because we're the chief medical officers of our own homes. We have so much going on. By the time we make an appointment, wait for the appointment, and get on the table, a lot of times we forget why we're there. We forget to ask a certain question, or we downplay our symptoms because we have to be more put together. So, by giving us the resources to properly record what's going on without diagnosing, by training our own AI with women's health data, not regular chat GPT, not data that's rooted in studies that had 80% males in them, actual health data that is about women. By taking a health guided assessment, we can give you the right questions and we can tell you, hey, you should bring this up to your doctor. And by doing that, we're allowing the doctor to have a more direct conversation, to be given more information, to help them get to that diagnosis quicker, more accurately by showing up for ourselves. We're not villainizing the doctor, we're giving women the resources to meet them halfway.
Amazing. I just want to backtrack to your initial health episode that you had. Where were you when you started to experience these symptoms, and what were the symptoms?
Yes. So at this point, I was, when the first episode physically happened, I was actually on the couch, which makes me it sounds so weird because I was not doing anything with an elevated heart rate. I was on the couch and I noticed myself going like this and like massaging over my heart area. And all of a sudden, I was getting really like short of breath,
Mm.
and my jaw started hurting, and I was starting to have pain down my left arm, which you don't have to be in the medical field to
Yeah,
know like heart attack, right? And
right.
that's what really scared me, was not only the jaw pain, but the arm pain. And
Hmm.
I remember being like, oh my God, what is happening? It did cross my mind, which the doctor pointed out, like maybe you're exercising too much because at that point I was cycling very frequently
Mm.
and I had gone to a cycling class earlier that morning, but I had never had an issue before. So I was on the couch. It was a normal day. I had eaten right. I had exercised. I was literally watching Lifetime Movie Network. So
And did you go to the hospital right away?
I did.
Yeah.
Yes.
And then they just kind of said, "Oh, everything's fine," and sent you home, and then you were getting them weekly.
Yes. And then they
Yes.
hooked me up to a heart monitor. They can tell if you had one, all the information that they can read on EKG. And I did not have one. They said it was probably a panic attack.
Mm,
And
yes.
because it was non-emergent, obviously I had to leave. So then they said, go see your PCP, your primary care. And
Hmm.
that's when I made the appointment. And because it was the heart, they were able to get me in rather soon. And I was in there within a week and a half. And it was, why are you here? What are your symptoms? So it's not a
Hmm.
heart attack. What have you been doing? And everything was the same. Because one thing they
Right.
ask as well is, well, have there been any changes to your exercising, to your diet, to your sleep, to your anxiety, to work, to family? And no, the answer was no. It was just another day.
Hmm. And okay, so PCP is personal primary
Primary care.
physician. You're based in the US. Just
Yep.
wanted to, because I know you said PCP before. We are GPs here.
Mhm.
So, or I'm not a GP myself, but as I say, we are.
Yeah.
Um, okay, the other question I had is the diagnosis that you got, costochondritis. Is that how you
Mhm.
pronounce it?
Costochondritis.
Costochondritis. So is that related to the heart?
Yes.
Okay.
So what it is basically the muscles that are over your heart are being
Mm.
a little spastic. And
Ah.
because they're over your heart, it's mimicking what would happen because your heart is also a muscle and it can affect what's happening over your heart. So that pressure, that tense, that everything happening on the left side of your chest, It's really mimicking what would happen, but obviously a heart attack would be much, much more painful, which
Right.
is what I had anticipated as well. I could walk, I could talk,
Yeah.
although my breathing was labored, I think it was more because I was afraid than
Yeah.
anything else.
The panic sets in, and so there is that element of panic, but of course there would be if you're having those symptoms.
Exactly.
Okay, thank you. I just wanted to ask a couple of those follow-up questions. But so then at what point after your diagnosis were you like, okay, I need to reroute my career and start Fox?
Yeah. So that's very interesting because I still have the first PowerPoint I ever made. And the reason why I made a PowerPoint was because I was like, I need to write my ideas down. Like what is this? Is it a website? Is it a platform? Is it a community? Is it a medical device? Is it an app? An app was actually it didn't come to mind until a year into speaking to a ton of people. And in this time, I had made a transition into startups. I had really more understood what that even means, the process, the team. And I've worked at two other startups, and it got to a point where I said, I was building for someone else's dream. Why not mine? I was working Fox on the nights and the weekends. I was dragging my fiance to coffee shops Saturday mornings and saying, okay, we're gonna sit in this coffee shop and we're gonna work together while we're spending quality time together, but I'm gonna be working. You'd find something to do too. And he's been so supportive. He's actually the one who encouraged me to quit my last job to work on this full time. But what really it came down to was I was seeing a lot of the same stories repeated online, and I was seeing a lot of cries for help in terms of we need this. And one thing we say at Fox is we can't change the system overnight, but we can change how prepared we are to survive it. And
Mhm.
that's really important to us because no, we're not the most innovative new thing on the block, and we're not sexy, and we're not something that's going to win these massive awards, but we're something that's going to impact women on a daily basis in their appointment. We're going to help doctors help women, and we're going to change the way women can actually navigate their health journey. And that was what was most important to me.
Yeah. I mean, I think that's pretty sexy to be able to impact women like that. I think that's definitely very cool.
Yeah.
Yeah.
And Maria, as you've been on your journey building Fox, and hearing stories of other women who have had experiences or who have been misdiagnosed, what stood out for you in terms of like what hasn't worked in the past, or what you saw that made you feel like, okay, there's a real opportunity here in terms of like both what you were hearing and what you were seeing?
hmm So, a lot of the stories that I hear where women are being dismissed and they're frustrated is because the majority of women are not doctors and
Mhm.
they're not people who have gone to med school. They're not MDs, OBs, which is extremely important to have women representation. But I noticed that more people were like me, the patient. And that's why I proudly say I don't have a health background because I'm not building for people with health backgrounds. I'm building for patients. And patients would feel frustrated going in and saying, this is what I'm feeling. Why can't you understand me? What's wrong with me? The doctor's not listening. But the gap is doctors are trained to listen for certain indicators
Mhm.
and symptoms that are going together. And if we aren't showing up with them meticulously documented ways of even severity, we've had doctors consult on how our symptom tracker is structured. So that way we're giving doctors information without giving them the diagnosis. Women tend to sit down, and because of our frustration, we say, this is what it is. I want you to look into this, instead of here is all the reasons, the severity, the region, how long I've been experiencing it, how long it happened, any medications, any pre existing conditions, giving them the full picture. And instead of showing up for ourselves, we're trying to show up and replace what the doctor is saying and doing. But that is also a product of being stepped on so many times during this process. So
Mhm.
what was missing, in my opinion, was a midpoint, a way for us to show up better to help the doctor, not villainize the doctor, because that's never what we want to do.
Yeah, the
Yeah.
doctors are there to support us and be on our team.
Exactly.
Yeah, and we're curious about what have been some of the conversations like that you've had with doctors as you've like talked about what you're doing and what you're building, and in sharing the stories, curious to hear the receptivity, or has everyone been receptive to what you're doing? What's some of the feedback that you're hearing from that community?
Absolutely. So, yes, spoken to many doctors, and we actually have two that sit on our advisory board. One is the lead NP of NPs, which is nurse practitioners in a large hospital system here in the States. And another is an OB who's also the lead medical advisor of another women's health app. So, through speaking to both of them, and then also, these past years, one thing that doctors hate is when anyone, not just women, women, men, come in and they have written things down that they found on Google. And the
Yes.
reason why they don't like that is because Google doesn't know your health history. It doesn't have the full picture. If you go into Google and you just search like my head hurts, it could be a headache, a migraine, brain cancer, worms in your brain. Like that
Yeah.
is so difficult to deal with because then doctors are like, let's rein it in, folks. Like, let's be more targeted at you. And that's where we came with the symptom tracking because doctors, the first thing is, why are you here today? And if you're like, well, I Googled what was going on, they're going to be like, oh man. But if you go and you say, yes, so the reason I made this appointment is because 2 weeks ago, for 3 days straight, I woke up and had throbbing pain that was mild to medium severity behind my left eye, and it was onset by light. Whenever I opened my blinds, that's what I got. That is such a different conversation, and the doctors can take that and help you with that. So, what we want them to do is not go into an appointment and the doctor say, please put your phone away, please put your app away, your piece of paper away. We wanted doctors to be a part of the conversation so that way if someone didn't have FoXX, they could tell the patient, for your next appointment, I recommend you download FoXX. I think that will really help us.
Hmm. I like this because it's like not just supporting the doctor, but this is a tool for the patient as well. Like, for example, I am that person when I feel a pain, I will go on Google and I have the worst possible outcome. And I freak out and I go into a panic and I go into a tailspin. And, I usually have to ask reassurance from like, my husband or my sister because I am such a worrier. And it's like, Megan, you're fine. Don't Google. Like, do not Google. But I can see this app being like a tool that will help subside my panic because it's like, okay, I have this symptom. I'm just going to put it in here. I will track it. And if it's showing an indication that, okay, maybe it's time that I bring this up to my doctor, then I'll just rely on this tool to help me. Like I really see this as something that would help my level of anxiety when it comes to specific symptoms. So as much as it is for the doctor, like this must be a really innovative tool for a patient to have in their advocacy toolkit.
Absolutely. And to be clear, too, this is only for the patient. We
Right.
want patients to have their own space to be able to show up. And with what you're saying, too, about the anxiety, that's what I talk to patients about. And that's what our AI is about. So, you have these symptoms. You can go and use our AI, and it will take you through a guided assessment to say, give me your age, your height, your weight, but also your race, your socioeconomic status, your location. What medications are you taking? What symptoms are you experiencing? Pre-existing conditions, and we'll run it through all of the data that we've spent so much time training. And what it will do is give you questions, not diagnosis, but it will say, okay, at your next appointment, here's what you need to ask. These two medications have never been studied together. Is
Mhm.
that something I should be thinking about? Or, this has been going for X amount of time. Does that have to do with my age given these pre-existing conditions? It helps you feel more prepared instead of going in and being like, yeah, so I Googled it and I'm going to die next week. So I hope you can tell me something different. And it really helps with what women are able to do, but also being prepared helps us take our mind off of it for everything else we have to do in life. And it
Hmm.
helps us be able to do both. It gives you, you pause. I'm going to log this symptom and then I'm going to move on. And
Yeah.
it's not, oh, I need to remember to say that to the doctor. So we really hit all of these pain points that women were telling us they had. Before we even began development, we did a user survey. We had 13 features that were everything. We're like, what if it had this and this? And the fun part. And we asked women to rank them, the top six. We're not going to make you rank 13, but we asked you to rank them. And my hypothesis when I started the app was that the most wanted feature was going to be a checklist. The preparation, that's what I wanted. I live my life by checklist, and I was like, this would help so much being prepared. But the number one feature request was actually our symptom tracker because women feel as though they don't have something like that where we look at you as a whole woman, not just your menstrual health, not just your mental health. It's really about your symptoms as a whole because we can't be siloed any longer. It's not sustainable.
Yeah. Yeah, I love that it's more than just a menstrual tracking app
Yes.
because that's
Yeah.
like you said, that's a lot of the technologies that are out there for women are based around reproductive health and
Yeah. It's like, let's focus on the things that make you different from a man, instead of let's focus on the things that actually make you a woman and make you a
hmm
whole person.
yeah.
Um, I love like when you start talking about the things that are the things that FoXX Health provides, and it makes me think that you guys really help like fill that context. And I feel like in so many ways in provider patient relationships and conversations, the context is always missing. And sometimes we don't know that it's missing, and we don't even know how to add the contextual information that is required to support some of the right conversations, because I think sometimes even when you're making an appointment with your primary care provider, you have to decide or make it clear to the nurse or the administrative team like what you're going in for, right? So this has to be about one issue that I'm going to talk to my doctor about, when really I love that this is providing that whole context and the whole picture to really, the way I'm thinking about it is really to help facilitate a more informed conversation, so that you can make better decisions, right? And I think that anything that helps women feel more empowered, as people in our own healthcare journeys, that's kind of like that context piece makes me think about what's missing and what has been missing from conversations.
Absolutely, because when doctors normally ask, what brings you in or why are you here? What are you experiencing? We tell them what we think they need to know, not
hmm
necessarily the whole story and the context. And we want to empower women to tell the whole story, to have everything on hand. We want to give women all the control. We should be working with doctors, and historically, women go into doctors and doctors know all like, oh, you don't have to worry about that. Okay, well, the doctor told me I don't have to worry, so I don't have to worry. There are so many emerging stories about how a woman went in, was concerned about a health issue. Doctor said, no worries, come back if it's still a problem. She comes back and is in stage 4 breast cancer, liver cancer, lung cancer, and passes away shortly thereafter. And when she came in, those were the beginning signs. Not only is research not up there, but the doctor also, how are they supposed to know if we aren't giving them the full story? But also, what is the full story? Women aren't expected to know that. We aren't supposed to go in having to write medical papers in order to be heard and justify it. And I mean, then we're turning into lawyers, right? Having our case and being like, listen to me. And it gets to be a point too where sometimes being so empowered can also be so exhausting.
hmm
How many times do I have to show up empowered? Why can't I just show up and receive care? And we want to make it a simple solution, an easy to use solution to give women all of the tools they need, all of the resources they need, because sometimes needing to show up for yourself and be empowered for something as crucial as healthcare can be exhausting.
Yeah. Um, I was hoping that you could give us a little explanation about the branding behind Fox and the meaning behind the name.
Hmm. Yes, I'm happy you brought this up. I've been asked a lot of questions in private about the name. Fox, when it originated a couple years back, was originally called Company XX. And that wasn't incorporated. That was just what I had because I loved the feeling of, the 2X chromosomes were focusing on women at our core. And as we developed, I wanted a punchy one word company name. And Fox it stood for females only, represented by the 2X chromosomes that make us women. As we've progressed and as the company has grown and as the landscape, especially in the United States, has changed, that has now become a political statement to say females only, 2X chromosomes. It took a couple weeks of thinking, speaking to advisors, speaking to the team, speaking to people within the communities where that would be offensive. And ultimately, we decided to keep it as Fox, and it stands for four only double X chromosomes. We've dropped female. But the reason we kept it at double X chromosomes is because that is what our data is trained in. We
Okay.
find studies where people with double X chromosomes are at the core. And the reason we do that is because we welcome anyone to use our app for symptom tracking, for speaking to their doctor. We also want everyone to be able to be smart and be as informed as possible when using any type of resource as it pertains to your health of what you are using. And our data is being trained specific to double X chromosome data, but that does not mean our app is not welcoming to anyone who chooses to use it.
That was my next question. Can anybody use this app? And you answered it.
Mhm.
Could you give us a kind of a customer journey experience of what it would be like to pick up your phone and use this app?
Mhm. Absolutely. So when someone downloads Fox, they're prompted to make a profile, of course, everything. However, one thing I'd like to point out very on in the customer journey is that we aren't asking you for your name. You make a unique identifier username, but all we ask for is your email. You don't even have to put your location. It's because data privacy is at the center of what we're doing. We want women to feel very comfortable on our app, only giving information that they see fit. Nothing is required. And then from there, you can go to your own profile. You can create a checklist. If you, for example, have concerns about your heart health, let's use me, for example, I could go in and even though I didn't have an appointment yet, I could create a checklist about what questions I wanted to ask. That's basic. We still have over 200 questions of basic questions that I've used from all the interviews I've had with providers, whereas our premium members will be able to use that AI function. If I were to use that AI function, I would go through the health guided assessment and put the type of appointment in because, of course, that influences the questions. What you ask an OB and what you ask a cardiologist will have very little overlap. And then from there, I'll be able to take the questions that are output from this assessment and add them to my checklist. What questions I want to ask, maybe there's a question on there I've already asked, or, it's not for the appointment type that I want right now. Maybe it's something in the future, or I'm just not interested at this point. From there, you can have a checklist. And then once an appointment is ready to go, you can tag it to an appointment or you can create an appointment over it. And we don't have functionality where you can search doctors, make an appointment. But what you can have is a place then to bring into your appointment your checklist. You can also add symptoms to it. So you have a home for your symptoms. You can go in there, log your symptoms, and say, for this appointment, here are my symptoms. Here are the questions I want to ask. And it's all in one place for that appointment for you to bring in. You also have a note taker in there. You have a medical term explainer in there. If the doctor says something and you're like, I don't know what that means, and you want to quickly AI really quick,
That's
we want to
cool.
give women the tools to be able to be interactive. We don't want them to sit on their phone and not talk to the doctor, but being able to check off, okay, we talked about this, we talked about this, make a little note if you want. There's also questions in there that aren't just related to health, but also your journey. What I mean by that is a lot of feedback we had is women will go and leave appointments and they won't know who's following up with who if they got a test. How long until tests are done? Are you calling me? What is going on? I spoke to one woman in particular. The doctor said, okay, we'll call you to make a follow-up appointment. with this type of doctor. And she waited and waited. A month goes by. She called, and the nurse was like, "Oh no, you're supposed to call us. And this doctor also has like a 2 month waiting list." And so for 3 months, she couldn't even get into the doctor simply because she didn't know who. So you can ask that question, who is supposed to follow up? What are next steps? When can I expect these lab results? Anything like that. And it's just making sure that you have all of the information. So between the symptom tracker, your checklist, it's all integrated, it's all in there. And then finally, we have Women's Health News, where we're partnering with trusted women voices who are publishing either blogs or trusted content that we're vetting all of. So you can go in and you can see new studies, you can see new technology, you can see new things happening in women's health. We don't want to gatekeep anything happening. We see ourselves as the conduit to get you to where you need to go. And last thing, we'll also have a social aspect. We call them the FoXX Dens. They will be specific to different types of women's health. There'll be an endometriosis den. There'll be a breast cancer den. There'll be a den for women who are exploring menopause. And I think it's really important that women have the opportunity to speak to other women. Reddit was the fastest growing social media for women's health conversations, and it's because women felt like they could talk to other women in an anonymous forum, truly be themselves, and we want to give them a safe space to do that on the FoXX app as well.
That's so cool.
Wow. Comprehensive, like so much that's part of this. One of the things that I love that it sounds like you've done a lot of is bring women voices into the building of this solution and really talk to women and understand their experiences. And that's something that is so core to what we do at Unum. Like, how are we bringing these voices into solution building, into creating better healthcare products, better healthcare services? And I'm wondering if you can tell us a little bit about your process for how you talk to women and where you did that and how you did that, and then how you took all of that feedback and really turned it into your solution.
Absolutely. And women are at the core of what we're building. And being a woman and a patient myself, I knew very early on I couldn't let my voice and my story be the only one that built this. As I mentioned, before we even started production, we put that user survey out, and my hypothesis was wrong. My hypothesis for a most wanted feature for the product was what I needed the most, but it's not what women needed. Now, don't get me wrong, mine was still top three, but it was not first. And it's important as a founder to be able to be like, okay, I need to talk to the people using it. So, in collaboration with my director of product and brand, who's brilliant, by the way, she recommended we put an unofficial advisory committee together of women who just wanted to be a part of doing exactly what you were saying, having their voice be heard, influencing our product, influencing our process. And from that, we just put a kind of the bat signal out on LinkedIn. We said, this is what we're doing, this is what we need. And we had 100 women sign up within 2 weeks. And
Wow.
spoke to them, and we have monthly calls with them, and they've influenced not only what we're building, but they've put out their thoughts. We've walked them through screenshots. They've given us honest feedback. And by honest, I mean the good, I mean the bad, I mean the have you thought about this, where sometimes the answer is yes and sometimes it's no. When we're building for women, we have to talk to more than just the women in our circle. And that's something that I've been very passionate about on this whole journey with FoXX. Maybe it's the slower way to do things. Maybe it's not the way where you need so many voices influencing it, but to be a consumer-facing company, a consumer-facing app that truly wants to impact women, in my mind, there was no other way to do it.
Yeah. And I mean, who's the decision maker of how fast or slow something is? Like I think you're just doing it the right way and the way that everyone should do it.
Yeah, that's a great point because I have to say, as a founder, there are a lot of people who are, you know, oh, I've been there. This is what you should be doing, and I've been there, and this is how it's done. And not a lot of people who are like, where are you at? And I'm going to see
Yes.
where I can help. And that's been very interesting on a founder journey as well.
Yeah.
Yeah, I think there's a lot of comparison in the founder world and just being an entrepreneur and seeing what other people are doing and thinking like, oh, I need to be at where they are at or getting questioned and then thinking to yourself, oh, do I need to be doing this or that? There's just so much comparison and imposter syndrome too. I'm sure
Absolutely.
you've felt imposter syndrome at one point or another.
Yeah, well, during my journey too, I was working really hard. I was blinders. I was like product, 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 people, people, people. And I looked up and I realized I was like, I don't have like a community of people around me aside from my team and the people that I'm working with, like our advisory committee. And so I started to build that and I started to reach out and I started to do what I thought was right. And I realized that it's just taken me away from product, 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 people, 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 which is the core of FoXX. So this over these past 2 weeks, I've actually been starting to kind of move things off of my plate. You can't do it all as a founder. As much as we try, you have to decide what rooms and conversations you need to be a part of. And once you start trying to do what everyone else is telling you, and oh, well, you need to talk to this person and this one, it it starts becoming a journey of self. And it's
Yeah.
like, do I want to be known as the founder who is truly, external, the socialite, which is important. And sometimes that makes business thrive. Or are you the person so obsessed with your product and your company that not many people have access to your calendar, but when you need to, you know who you can call?
If you're listening to this episode right now, you can visit the link in our show notes. But we're so excited for you, Maria. And this is just such an innovative tool for women, for people to be able to advocate for themselves in a different way with less anxiety attached to it. So we really applaud you, and we're so excited that we were able to connect and learn all about everything that you're doing, and we can't wait to see how it evolves.
Yeah, thanks for having me. And for anyone listening, I meant what I said. It's the product and the people. If you want to reach out, tell me about your experience, any features you love, any you would like to see. I am all ears to you